Baseball players, listen up. If you ever felt that sharp pain in your elbow after a hard throw and you're worried, is this the end of my season? Well, you're not alone. There is some good news. Surgery isn't your only option. And so in today's video, I'm gonna show you how you can treat elbow pain, put that glove on again so you can get back to throwing faster and stronger without having to go under the knife. So stay tuned because this just might save your arm and your career. If you're new here or you just don't know me, my name is Dr. Cam and I'm a double fellow, residency and trained, sports, orthopedic, spine, and manual physical therapist, as well as a faculty member in a doctor of physical therapy program. And so on this channel, I provide you with so many strategies and tools so that you can throw hard and stay healthy. So why does this elbow pain happen in baseball players? Throwing a baseball puts so much stress on your elbow, specifically on a ligament called the ulnar collateral ligament, or the UCL. So during high-speed throws, your elbow is subject to extreme valgus stress, where the inside of the joint is actually stressed and the outside of the joint is actually compressed. This constant stress can lead to wear and tear over time, resulting in micro injuries that eventually cause that sharp or dull elbow pain you feel after the game. But here's the important part. This doesn't mean you need surgery right away. In fact, most cases can be managed with just non-surgical treatment if addressed early. Now let's dive into that non-surgical management option. The first component is rest, and I know that's probably not what you want to hear, but resting your elbow gives the tissues time to heal from all of the stress I just talked about. After adequate rest, we start on an individualized rehab program, not just a generic one, focusing on strengthening not just the elbow, but your entire throwing chain, starting from the core, to your shoulder, to your arm, to your legs. Now, one of the best exercises you can do to simply protect the elbow and the forearm is just a wrist flexion exercise. This helps strengthen the muscles in your forearm, which can help relieve pressure from that elbow joint. There are muscles that connect to the UCL, so there's another trick. And if your injury is so severe, there's a great option called a PRP, or a platelet-rich plasma injection. With PRP, they take your own blood, concentrate the healing factors, and inject it right into your elbow. This accelerates the healing process and actually can help you avoid surgery. Studies show that athletes who use PRP in rehab can often return to throwing in just 12 weeks without needing a surgical intervention. But you can't just get the injection, wait 12 weeks, and bam, 95. You gotta rehab after that. Once your elbow starts to feel better, I know it's tempting to get back to throwing right away, but one of the biggest mistakes I see is players returning too soon without fixing their mechanics. Bad pitching mechanics put so much extra stress on the elbow. So during your rehab, it's crucial to work on the form. If you're not sure where to start, you need a coach or a physical therapist who understands pitching mechanics, not just some guy who gives you exercises and returns you to throwing, or not just some coach who tells you to push harder into the mound. Once your mechanics and strength are solid, we'll start a throwing progression. And usually this is a step-by-step process where we slowly build your throwing volume and intensity back, keeping your elbow safe. It's all about balance, building up your entire body to support your arm and prevent future injuries. And if you reach a bump in the road where your elbow starts to become sore, we backtrack, because the worst throwing program is written in pen, not pencil. And honestly, that's how you treat and recover from elbow pain without needing surgery. By following these steps, rest, rehab, mechanics, and a progression, you'll not only get back to playing faster, but you'll throw harder and more safely than ever before. And if you enjoyed this video, you'll also probably like my video on elbow pain relief, what the doctor doesn't want you to know. And just remember, I'm Dr. Cam and I got you.